There are a few things that one should do to prepare for surgery. I'm only going to discuss a few that I believe are geared more towards my plus size or high BMI patients. Now, these are my recommendations. Other plastic surgeons have some other very good ones, but I'm just going to point out my top five in no particular order. Number one, exercise. Exercise at least 1 month prior to surgery. Do some type of aerobic activity at least 4 days a week. An example of this is simply walking a mile or walking 10 blocks. Um, do that 4 times a week. This will really help you get conditioned for your post op recovery. Now, obviously, I would recommend this to everyone, regardless of whether or not you're having surgery, but it definitely helps. Number two, eat a protein rich diet. Vegetables, lean meats, supplements are okay. Everyone asks about supplements, but I encourage eating sensible meals, not dieting. Replacing sugar and carbs with better choices is all. Number three, wear some type of girdle or some type of restrictive garment, compression garment. This will simulate the effects of a tummy tuck and it'll prepare you for what it may feel like after surgery, particularly if you're having a tummy tuck. Number four, stop all herbal supplements. The recommendations on this is usually about 2 weeks before surgery. For prescription medications, we need to be very specific on when to stop these. This goes specifically for GLP-1s like Ozempic and Mounjaro. Also, you need to stop any type of birth control or implants or hormonal replacement devices. These need to stop a month before surgery. We'll give you individual instructions for doing so, but it's very important that some of these are stopped before and sometimes much earlier than 2 weeks before surgery. Number five, make sure to get your medical clearance from your primary doctor in advance. Don't wait until the last couple of weeks before your surgery. Safety is always the priority. We don't want any surprises. If you're on medications, well, you want to make sure that they're doing what they're supposed to be doing. We want to make sure that your lab work, x rays, EKGs, all of those things needed for clearance are up to date. These are just a few of my pre op recommendations. Feel free to schedule a complimentary consultation at highbmi.org for any questions that you may have about what we just covered. Thanks.